Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Izzah Sahira Binti Farid. The disease that I have chosen affecting endocrine system is Graves' disease. Firstly, I would like to share with you the overview for Graves' disease. So Graves' disease is an autoimmune disease of thyroid gland. It is characterized by the production of autoantibodies against multiple thyroid proteins. The most common antibody known as thyroid-stimulating immunoglobulin TSI is observed in approximately 90% of patients with Graves' disease. TSI will bind to the TSH receptor and mimics its actions. That will increase the release of thyroid hormone, which results in hyperthyroidism. Graves' disease is caused by a malfunction in the body's disease-fighting immune system. The immune system cells exposed to an environmental trigger will generate an immune response because of genetic sensitivity genes mutation within these genes, and that will develop an exaggerated immune response, and plasma cells will produce antibodies that attack the thyroid gland itself. The environmental trigger includes stress, infection, cigarette smoke, malnutrition, immune deficiency disease, and pregnancy. Now let's talk about hyperthyroidism. So hyperthyroidism is commonly caused by Graves' disease, which is an immune system disorder that results in overproduction of thyroid hormone T3 and T4. Firstly, thyroid hormone are released as part of the hypothalamic pituitary thyroid axis. The hypothalamus will detect a low plasma concentration of the thyroid hormone and releases thyrotropin releasing hormone TRH into the hypophyseal portal system. The TRH will bind to the receptors found in thyrotropic cells of the anterior pituitary gland, causing them to release thyroid-stimulating hormone TSH into the systemic circulation. The TSH will bind to receptors on the basal lateral membrane of thyroid follicular cells and includes the synthesis and release thyroid hormone T3 and T4. Once both of the thyroid hormone T3 and T4 release from thyroid gland, these hormones enter the blood and bind into circulating plasma proteins. Only a small amount of T3 and T4 will travel and bound in the blood, and these two hormones get picked up by almost every cell in our body. Once they got into the cell, T4 is mostly converted into T3 and it can exert its effect. So T3 will speed up the basal metabolic rate, and for example, it will produce more proteins and burn up more energy in the form of sugar and fats. Then it can also increase cardiac output and stimulates bone resorption, and also activates the sympathetic nervous system, which is responsible for our fight or flight response. So these are the risk factors for Graves' disease. Firstly, we have family history. There is likely genes that can make a person more susceptible to this disorder. The next one is gender. Women are much more likely to develop this disease than men. 2 in 200 women have the risk of developing Graves' disease. However, in men, 2 in 1,000 men have the risk of developing Graves' disease. The next one is age. So Graves' disease usually develops in people before the age of 40. The next one is our other autoimmune disorders. For example, people with type 1 diabetes or rheumatoid arthritis will have an increased risk of developing Graves' disease. The next one is emotional or physical stress. Stressful life events can act as a trigger for the onset Graves' disease among people who have genes that increase their risk. The next one is pregnancy. So being pregnant can increase the risk of this disorder among women who have genes that increase Graves' disease risk. Lastly, we have smoking. So as we all know, smoking will affect our immune system and also will increase the risk of developing Graves' disease. Now I will talk about the symptoms of Graves' disease. So it is usually associated with gradual onset of symptoms which takes several weeks or months to develop. Firstly, we have anxiety, feeling shaky, nervous, sweaty, insomnia, and for women, they will have disturbance in their menstrual cycle, and for men, they will have erectile dysfunction. So these are just the additional symptoms. Firstly, muscle weakness, intolerance to heat, increased appetite, weight loss. So for this part, Despite of having an increased appetite, they will still lose weight because of higher basal metabolic rate. And then they have fatigue, tachycardia, which is racing heartbeat, loss of hair, tremors, brittle nails, exaggerated reflexes, and diarrhea. Thyroid-stimulating immunoglobulins, TSI, will target and activate the TSH receptor that will cause goiter, which is an enlarged thyroid gland, because of hypertrophy and hyperplasia of the gland. Okay, the next one is the build-up of glycosaminoglycans because of inflammation and swelling around the eyes that will cause exophthalmos or bulging of the eyeballs. This is called Graves' ophthalmopathy. And very rarely, patient may develop a skin condition known as myxedema or pretibial dermopathy. So this condition is characterized by the thick and reddish skin on the front portion of the shins. This condition is called Graves' dermopathy. In exceptional cases, patients may also have soft tissue swelling of the hands or clubbing of the fingers can also be observed. Lastly, patients also can develop congestive heart failure with life-threatening consequences. So these are the methods used to diagnose Graves' disease. The first one is blood tests. So this can help doctor determine the levels of thyroid stimulating hormone TSH and also detect presence of specific antibody. The next one is radioactive iodine uptake. So this method involving by giving a small amount of radioactive iodine and also later measuring the amount of it in thyroid gland with a specialized scanning camera. The amount of radioactive iodine taken up by the thyroid gland will help determine if Graves' disease or another condition is the cause of the hypothyroidism. And next one is ultrasound. So this method uses high frequency sound waves to produce images of structures inside the body. For example, goiter, which is an enlarged thyroid gland. It is most useful in people who cannot undergo radioactive iodine uptake, such as pregnant women. The next one is imaging tests. If the diagnosis of Graves' disease isn't clear from a clinical assessment, doctor may order special imaging tests such as CT scan or MRI. Now I'm going to talk about the treatment for Graves' disease. So the treatment goal is to reduce the amount of circulating thyroid hormone. So firstly, we're going to use anti-thyroid drugs, which is methimazole, carbimazole, propylthiouracil. So these anti-thyroid drugs will decrease thyroid synthesis. Here, carbimazole is usually successful in treating patients with Graves' disease and leave them with normal thyroid function. For propylthiouracil, although it reduces peripheral T4 to T3 conversions, there is a small risk of severe hepatic or liver reactions. These reactions can be severe enough to cause death, which is why carbimazole is more preferred option. The next one is beta blockers. Beta blockers are used for symptomatic relief, for tachycardia or anxiety. And then we have thyroidectomy, which is the removing of thyroid gland by surgery. This will effectively stop the production of thyroid hormone because you don't have the thyroid tissue to produce the thyroid hormone anymore. Okay. However, the problem is the patient will be left with hypothyroidism, and the patient will be require levothyroxine replacement for life to replace that thyroid hormone that they no longer producing. Lastly, we have radioactive iodine therapy. It destroys a portion of the thyroid cells and it decreases the amount of thyroid hormone that is produced. This therapy takes about 6 months, but there are strict rules to this therapy, which the patient cannot get pregnant for 6 months, and they have to avoid close contact with children and pregnant women. Also, they have to limit contact with anyone because of the radiation of the iodine. That's all from me. Thank you so much for listening.